Hello, and welcome to Perspectives in Care, the first and only ePro platform scientifically validated to improve patient and provider outcomes in pain management settings. The purpose of this short video is to give you a brief introduction to the platform so you understand the why, how, and when of Perspectives in Care. So first, the why. Each time you prescribe a controlled substance, such as an opioid, you are required to meet a medico-legal standard. This standard is known as legitimate medical purpose, and it comes from Title 21 of the Code of Federal Regulations. To meet this standard, you must determine and document up to 26 unique pieces of patient data. But it's not enough to just document the data point. You must also use the acceptable method of assessment, correct frequency of assessment, and choose the correct outcome, all prior to issuing a prescription. Furthermore, the frequency of assessment can change depending on the outcome and the responses from the patient, making meeting this standard nearly infeasible for most pain clinics. A brief review of prominent case law reveals that these data points must not only be met when you initiate an opioid, but each time you continue it. And that's where Perspectives in Care by SureMed Compliance can help. Our digital intervention allows patients to self-report the most time-consuming of these data points ahead of time, outside of the office, on any internet-enabled device. Once submitted, responses are scored, summarized into a summary report, and delivered right to the patient's chart inside of your EMR. Each date-stamped legal report contains over 50% of the data points required to meet the standard legitimate medical purpose. These reports also contain clinical information that can help you make a more educated treatment decision and improve your dialogue with the patient. Finally, from time to time, you may notice industry-relevant advertisements on the bottom of the summary report. These services and products have been hand-selected by our independent oversight committee and have met the inclusion criteria, ultimately being deemed beneficial for patients and providers. We encourage you to learn more about these products under the Partner Resources tab on the dashboard. Next, how. Perspectives in Care has been over-engineered for simplicity. Someone in the practice will be designated to hand out the patient welcome letter to patients as they present in the office. This letter can be found under the Documents tab on the dashboard and should be handed to all patients in the practice, not just those being prescribed an opioid. For the team member handing out the welcome letter, it's important to stress that the completion of this evaluation prior to each office visit is a condition of treatment, and it must be done to avoid being rescheduled. Clinics that do not follow this rule have a much lower participation rate, leaving both the provider and the patient exposed to excessive risk. If you're a provider, your only requirement is reviewing the summary page when you're with the patient at the point of care. This report will already be migrated into the patient's chart and may look like a lab result. According to our time and motion study, it took most providers under a minute to fully review and understand the summary report. You can find more information on how to interpret this summary report in the user guide located under the Documents tab on the dashboard. Lastly, when. Patients should be instructed to log in and complete an evaluation at some point in between office visits. That means patients who are seen monthly should complete monthly evaluations. Patients that are seen quarterly should only complete an evaluation every 3 months. This frequency is important as it most closely aligns with how legitimate medical purpose has been defined in case law. From start to finish, this should only take patients between 10 and 15 minutes to complete. If you have questions that were not addressed in this video, please feel free to reach out to SureMed Compliance representative at 866-517-2771. You can also visit us online at suremedcompliance.com. Thank you for your time. In this part of the video, we're just going to walk you through the dashboard and some of the functionality that exists here. The way that you'll log in is to go to perspectivesincare.com and go to Physicians and click on that tab and then click Log In, use your credentials. And this is the first screen you're going to see. This is our dashboard. And as patients complete their questionnaires, they will populate on this screen in chronological order. If you're using any of our integrations, you will not have to look in here for those results. You can simply look into the patient's chart and they should populate there automatically. But if you are on this screen, I just want to show you what some of the different features are. So we'll just take a patient, the first patient that comes up right here. If you want to view it here, you just click on this PDF button right here towards the right, and it will automatically pull up the patient summary report. And you can make that bigger or smaller depending on how you like. And then you can simply just scroll through. And if you'd like to see how they answered every question and the scoring legends, you can continue to scroll. And at the top, you'll find the scoring legends. But again, most people will not have to use that function. And then if you want to see previous assessments, you can click on previous assessments and see how many they've done in the past, how long it took them to take these assessments, and then the device they used, whether it was the portal or the application. And then something over here that's important, this is the pharmacy report. So from time to time, your clinics may get requests from pharmacies for additional clinical information. Rather than going into the note and pulling that information and scanning it and faxing it over to the pharmacies, you can simply just go right into here, find the last assessment the patient took, which it'll be the one on the top line, and click Export Pharmacy Report. This report is exactly the same as the other reports that you just saw. The only difference is there will be a cover page on here that will explain to the pharmacist why they're getting this. And this says you're receiving this report because a prescription for a controlled substance was issued to the patient. It'll give their name and their date of birth by a practitioner enrolled in the Perspectives in Care program by Sherman Compliance. It'll also explain to them this is to help them meet the standard legitimate medical purpose. Obviously, as the pharmacy also has a corresponding responsibility, they can also save this for their records. And then again, if you scroll down, you'll see the same summary report that we saw earlier. All right, I'm going to go back to dashboard now. And so the next tab down is Manage Users. This is, you can manage any users that are in the system here. If you want to add a provider, activate or deactivate providers, delete them, or edit their profiles, you can do that right here on this screen. So most practices are just having a few people that log in, so there's really no need to do that. But if you do have a clinic admin that leaves and you need to replace that clinic admin, you can simply do that here. That's the Manage Users tab. And then the Documents tab is the one that you're going to probably end up using first, and that's because that's where the welcome letter is. You can see right here, if you click on that, it'll open up a number of different welcome letters if you've got multiple providers, but most clinics, you just really want to print one of those welcome letters and use the same one for everybody. You can download the form to the right there, and then you can print it. So that's the Documents tab. If you'd like to see our updated terms of service from time to time, or if you'd like to look at our web user guide, which gives you more information that this video is already providing, you can click on that. And then there's a PDF version of that. And then there's the office sign. I'm going to click on this just to show it to you real quick. The office sign is important because this is the sign that should get posted somewhere in the clinic. I'm going to go ahead and share that sign with you real quick so you can see. So this is what it looks like. This is actually a Word document. So we do like offices to go ahead and print this, post it somewhere. It lets patients know that this is going to be typically going to be a requirement, a condition of treatment. Helps to have that conversation on why that they're being asked to do this. You can also, instead of saying our practice, you can just insert a picture of your logo there. Like I said, this is a Word document. If you go down to partner resources, you'll find people that we partner with. You can click on any of those. These are life sciences companies. And if there's any resources there, you can click on those, watch videos, download sometimes coupons, savings cards for products, things like that that patients may use. That's where you'll find that information. EHR Probable Match. This one's really important. I'm going to click on that real quick. We're not going to have any information in here because I'm using a demo account. But every now and then within your clinic, a patient will have completed the questionnaire, but it's not showing up in the EHR, and you don't know why. The first thing to do is just to come over here and look, because every now and then you'll have somebody like, let's just say a Patricia Robinson who enrolls in our program, and she spells her name as Pat Robertson rather than Patricia. We use 3 identifying characteristics to link those patients within the EHR. It's the first name, last name, and date of birth. So if any of those are off at all, sometimes they'll enter a wrong digit when they put their date of birth in. The patients will show up here. And what this is it'll just show what the patient's first name, last name is it a match or not? And then you should be able to look at you'll be able to see other identifiable characteristics here that you can see that it actually is the patient. And all you have to do is on that action button over there, just click that it is a match or it's not a match. If you do that, just know that you only have to do it once for every patient. If you go over to settings, this is where your consent forms are. We know that in most of our clinics, they are having patients sign informed consents as well as controlled substance agreements. You can actually upload your own file right here and have patients electronically sign that once a year. So we encourage you to use that feature. If you'd like to do an additional consent form, such as a controlled substance agreement, if you look at the very bottom here, you can do that there as well. And then finally, Notifications tab. This is where you can search for patients by name, or you can select all patients. And if you do, that'll actually select every patient that's gone through this questionnaire that's enrolled in your practice. You can actually select a template. So if you wanted to put a template on there to remind them that they didn't take their perspectives and care assessment, you can do that. And then you can send notification. If you don't want to use a template, you do not have to. You can actually just create another notification title. So for instance, if you wanted to say something like, the office will be closed in the subject line, and then in the notification body, please note our office will be closed on Labor Day. You can do that as well. And if you wanted to save that message as a template, you could simply do that and it would show up under your templates next time you go to do this. And again, you can send these notifications to any patient in here or all of the patients at the same time. As we add new features, I want you to just know that we will be adding some new features. One's going to be called candidate quiz results, and that's going to be where you're able to set criteria, have the system flag patients that might be a candidate for certain procedures. That feature will be right under the notifications tab on the left justified menu. So as new features are added, just know they will be added to this left justified menu. I hope this has been helpful. The last thing I'll just tell you is search users. If you do want to find anybody within your practice, you can search users by clicking that little thing up to the right there. You can search by providers. You can search by the patient's name, date of birth, start date, end date. If you wanted to just see how many patients in your practice that have taken this are just high risk, you can do that, moderate or low. And then there's a date range function as well. So again, I hope this has been helpful. And thank you for using Perspectives in Care.